Okay, so we're going to continue. Can you face me again? And we're just going to finish up with the nose. So we assess the patency of the airway. I'm just going to assess the sinuses now as well. So I'm going to push down on your sinuses, and if you feel any pain or discomfort, let me know. Okay. Was that okay? No pain?
Mm-hmm.
Okay. And open your eyes. And how was that? Good. Okay. Okay, then we're going to move on to the mouth. So I'm going to assess the lips for any lesions around on the skin around the lips. And there's nothing there, so it's good. So I'm going to ask you if you can pull down your bottom lip, and I'm going to check your gums. Okay, so gums are pink and healthy, and the mucosal tissue also is pink and healthy on the bottom, and the teeth look good. And now for the top. Okay, and same thing up here. All right, so everything is pink. It's a good look for you. Okay, and now if you can open your mouth and then pull to the side, and I'm going to check one side. Okay, and now the other side. And in both, the mucosal tissue is the buccal tissue is very pink and healthy looking. And now if you can open your mouth and say ah, and I'm going to inspect your hard and soft palate. Ah. Okay. All right, thank you. And there's no discoloration of the palate, and it looks healthy. Okay, so we are going to move on. I'm going to check your temporal pulse here, see if I can find it. Okay, I can feel it there, nice and strong. Okay, and I can feel it there on that side as well, so that's good. Now I'm going to check your temporomandibular joint. So I'm going to ask you just to open and close your mouth a few times. Okay, so you can open it. Okay, close it. And again. Okay. And now move to one side to this side.
Like move my jaw?
Yeah.
Oh.
Okay, and now to the other. Okay, so I noticed some slight clicking in her left jaw.
Mm-hmm.
So I'm going to make a note of that. All right. Now I am going to check the lymph nodes. So I'm going to start off with the preauricular lymph nodes, and so I'm going to palpate them, I'm going to feel them, and if any of them are sensitive or tender, let me know, and if I notice any, if they're swollen or enlarged, I'm also going to make a note of that. Okay, so I'll start with the preauricular, okay, and the postauricular, and the ears, the occipital, okay, no noticeable lumps there, any of those were tender. Okay, then I'm going to move along to the temporomandibular. Okay, and then the submandibular and the submental. Okay, none of those were enlarged either. Okay, so I'm going to check your cervical ones now. Okay, so I'm checking the cervical, the deep cervical chain, and the posterior cervical, okay, and the superficial cervical. Okay, and now if you can just like hunch your shoulders a little bit, and thank you, and I'm going to check for the clavicular, supraclavicular. Okay, and did any of them along your neck, did you feel any tenderness there?
No.
Okay, and there was no noticeable swelling either. So now I'm going to check your carotid pulse. Okay, and I can feel it right away. Okay, and both sides are even and it's nice and strong. Okay, so that concludes this portion of the assessment. So I'm just going to perform hand hygiene. Did you have any questions about that? Okay, then we'll continue the next part right away.